People in Massachusetts have 3 more weeks to sign up with the state program for individual health plans. During the open enrollment period through August 15th, they can use the Mass Health Connector to choose coverage from a number of insurers. It's possible for people in the program to choose a different health plan also. And to tell us about the plans and the process is our guest from the Connector, the Executive Director, Glen Shor. Thank you very much for being with us, Glen.
Thank you for having me.
First of all, it seems unusual to be making the pitch for new business here, but how many people are out there who actually need this stuff right now still?
There are about 120,000 people in Massachusetts who purchase coverage on their own, about 32,000 of them who buy coverage on their own using the Health Connector's innovative web-based shopping experience. This is an opportunity for them to shop and compare their options and pick comprehensive coverage that best suits their needs and their budgets. It's a really important time for people to shop, compare, and choose, even people who currently have coverage right now. Right now they can choose a different plan, they could choose a different health insurer. If they wait and their current coverage expires outside this open enrollment period, their only choice will be to renew into their existing coverage. So we want to really highlight that between now and August 15th, now is the time to shop, compare, and choose the coverage that best suits your needs and your budget.
How do people shop exactly? Because I imagine sometimes, especially if you've got somebody who's in the middle of their work life at least, and they've been seeing doctors, they want to keep most of those doctors, so what do they do if they want to get a different plan?
Well, we try to make it easy for them. That's the purpose of the Health Connector, to empower people to be more effective shoppers for health insurance, to put that information at their fingertips. We have an innovative web-based health insurance shopping experience. People can log on at www.mahealthconnector.org. They could log on to our website, and we make it easy for them to compare among 6 plans for adults, another 4 plans for young adults ages 18 to 26, which run the gamut of plans with higher deductibles and lower premiums, and higher premiums and lower point of service cost sharing. We want to give people a good range of options to choose from, and also a presentation and a process that makes it simple for people to understand their choices.
Of course, one of the important questions for people who might still be on the fence about this is, you sometimes hear, maybe more from other states, that you don't need insurance to get health care. So what's the big advantage of having insurance?
Insurance opens opportunities for people that they wouldn't have without insurance. Opportunities to have their own doctor, have access to preventive care, access to a full range of treatments and medications, and of course, the financial security that you need in the event that you get sick and something unfortunate happens. Having the peace of mind and the financial security that health insurance brings is invaluable. It helps keep people healthy, and it protects them when they get sick.
Of course, the other advantage, at least for some people here, is affordability, all the more so if they're entitled to some kind of subsidy. Explain how that works.
People in Massachusetts buy health insurance in a lot of different ways. There are many people, in fact, most people who get health insurance through their jobs, they are not affected by this open enrollment period. There are some people who get health insurance through government-sponsored programs if they're low income. The government in Massachusetts, along with the federal government, contributes subsidies to make health insurance affordable for them. Those are people who might enroll in the state's Medicaid program or the Connector's own Commonwealth Care program. There are also people who purchase health insurance on their own, using their own dollars, not getting it through a job. Those are the people to whom this open enrollment period applies. Again, there's about 120,000 of them in Massachusetts. And the Connector's Commonwealth Choice Program is the place where about 32,000 of them have to date shopped for coverage, purchased coverage from among the state's most popular health insurance carriers, choosing among a wide range of options.
Of course, when people don't qualify for some kind of subsidy, I guess the appeal of this plan is there's supposed to be leverage so you can get a better deal from insurers. To what extent has that been working out for you?
We bring the power of transparency to the health insurance shopping experience. While we don't negotiate prices with health insurers for this population, what we do is we put people in the driver's seat, giving them the information they need to make good choices about the coverage that best suits their needs. By making the shopping experience transparent, by laying it out there on the web, by making it easy for them to make apples-to-apples comparisons among their health plan options, we allow them to see more affordable coverage options more clearly. And many people switch plans or first sign up for more affordable options precisely armed with that information.
Do you think these insurance companies are making adjustments to match that kind of consumer demand? Do you see that happening in a healthy way?
I think we're frankly at the beginning of our experiment on this. We hope that the process of making it easier to find affordable options online and putting that information at the tips of people's fingers will not only allow them to find coverage more affordable immediately, but also spur competition among health insurers to put even more affordable options on the table. We hope the program grows so that competition really takes off.
Okay, we will end up by asking you to explain how people can go and get more information. But before we get there, talk about a couple of other things going on here about the playing field. The governor is trying to do more about cost control because that has been a problem with all kinds of health insurance in Massachusetts. So what can we look for right now?
Massachusetts has led the nation in expanding access to health insurance. We have over 98% of our residents insure the highest rates of insurance in the nation. The next challenge is to make sure that health insurance is affordable for everyone. Governor Patrick has been a real leader on this issue, using his existing powers to try to make health insurance more affordable, and recently filing legislation to take the next step forward, payment reform that makes sure that doctors and hospitals are paid for value of the services they provide, not necessarily based on the volume of services provided. The goal here is to make healthcare more affordable for everyone, not by putting more financial burdens on people, but by delivering better, more evidence-driven, cost-effective care. Massachusetts can lead the nation in cost containment, just like it's led the nation in expanding access to health insurance, and I think it will.
Of course, an important part of the formula for making this affordable is Medicaid money. Roughly half of that comes from Washington. Down in Washington right now, they're talking about cutting back on money probably for programs like this. It sounds like this is really going to be a problem.
I think there are many eyes in Massachusetts watching how things evolve in Washington as it grapples with the federal budget deficit. There's no question that the federal government has been in a partnership with government in Massachusetts to make healthcare more affordable to many of our residents who, without subsidies, would be uninsured. We need to maintain a strong partnership with the federal government to ensure that health insurance remains within reach of even the lowest income members of the Commonwealth.
And finally, we should mention if people want to find out more information or sign up during this enrollment period, you've got a number and a website they can go to?
Sure. The website is www.mahealthconnector.org. And the telephone numbers are 1-877-MAENROL or 1-877-623-6765.
All right. Thank you very much for being with us.
Thank you. Thanks for having me.
From the Mass Health Connector, Glen Shor will have more news in just a moment.